Hello everyone, I am Dr. Tayashri Bodicharla, consultant doctor in Fidicus Homeopathy. Today we are going to discuss one of the most common diseases affected by the many women across the world, that is ovarian cyst. In this video we will mainly understand what is ovarian cyst, what are its types, its causes, their symptoms and also the risk factors of this ovarian cyst. I can explain this condition clearly on the board. Let's move on to the board. Now let us discuss what is ovarian cyst. Usually, ovaries are the most important organs in our female reproductive system. This is our female reproductive system. These two are the ovaries on either side of the uterine cavity. These ovaries produces eggs every month and also secrete hormones like estrogen and progesterone hormones. During this process of releasing of egg every month, these ovaries contain some cyst-like structures. These are filled with water or other substances. These cysts are nothing but called as ovarian cyst. So simply, ovarian cyst are nothing but the collection of fluid among the ovaries, that we call it as ovarian cyst. Usually these ovarian cysts are most common among reproductive age women, those who are sexually active and menstrually active. In these women, more chance of getting ovarian cyst. Most of these women can suffer from these ovarian cysts silently, but in some conditions where rupture, torsion or enlarging size of the ovarian cyst can cause severe complications. These severity of the symptoms mainly depends upon the size, rupture and torsion of the ovarian cyst. Now coming to the what are the different types of ovarian cyst. There are two types of ovarian cyst. One is functional cyst, other one is pathological cyst. Functional cysts are formed during the normal functioning of the ovaries, and pathological cyst where there is an accumulation of any extra tissue or growth of the tissue. We call it as pathological cyst. In functional cyst, two types of cysts are there. One is follicular cyst, other one is Corpus Luteum Cyst. In functional cyst, this is the follicular cyst. There are several follicles in the ovaries. If these follicles break open to release the egg, this is the normal process. When these follicles fail to rupture and also fails to release the egg, this leads to accumulation of fluid in that follicle. This we call it as follicular cyst. Follicular cyst is formed during functional process of the ovaries. Next one is Corpus Luteum Cyst. As all you know that after releasing of the egg from the follicles may transform into structure called corpus luteum. When these corpus luteum accumulates fluid and form a cyst-like condition, we call it as Corpus Luteum Cyst. These cysts also produces hormones, but in most of the conditions, these functional cysts are harmless until they causes symptoms. Next, coming to pathological cyst. These pathological cysts are formed due to some accumulation of the tissues or cells of the ovarian cavity. In these pathological cysts, one is dermoid cyst. Dermoid cyst is a unique cyst. Why it is unique means this is the cyst where the tissues are developed from the germ cells. Germ cells are the birth cells. From these germ cells, all the organs should be formed. In these dermoid cysts contain hair follicles, tooth, and also skin structures. All these structures constitute the dermoid cyst. This is the unique structure. And in some conditions, the ovarian layer itself develops into a cyst form, that we call it as cystadenoma. This is found mainly due to accumulation of water or the serous fluid. Due to this accumulation, cystadenoma may be formed. Next condition is endometrioma. Usually endometriosis is the condition where the inner lining of the uterus can grow other than the uterus. When there is inner lining of the uterus grows in the organs like ovaries, we call it as ovarian cyst, that we also call it as chocolate cyst. Why it is chocolate means it is just looking like a chocolate, like brown color. In this endometrioma, this uterine lining maybe grows on the ovaries, and this can also respond to hormonal changes in the female body. Apart from this, one more structure is PCOS follicles. In PCOS women, due to this hormonal imbalance, several multiple follicles may be developed in the ovaries. These follicles also collect the serous fluid and becomes cyst-like structures, that we call it as PCOS multiple cyst. So, ovarian cyst is of two types. One is functional cyst, second one is pathological cyst. In functional cyst, follicular cyst and corpus luteum cyst are there. In pathological cyst, one is dermoid cyst, next one is cystadenoma, and third one is endometrioma, other is PCOS related multiple cyst. So this is all about the types of ovarian cyst. Now coming to the symptoms of the ovarian cyst. There are multiple symptoms in ovarian cyst conditions. Among these, one is pain in lower abdomen. There is dull, sharp or sudden pain in the lower abdomen region. And other one is heaviness or bloating in the lower abdomen region. Due to this large cyst or the present symptoms of the cyst, there is feeling of heaviness or fullness in the lower abdomen region. Next one is due to this development of the cyst, the periods may be irregular. It may be heavy or scanty periods. Sometimes it may be too long or too short periods. Next one is dyspareunia. Dyspareunia means pain during intercourse. The woman may complaining of pelvic pain in the lower abdomen during intercourse time. This is mainly due to endometrial cyst. When these ovarian cyst patient also complaining of the frequent urination, burning urination, sometimes frequent bowels or constipation symptoms. Due to pressure symptoms developed by this ovarian cyst, these cysts can enlarge and cause pressure upon the surrounding structures. So these symptoms may be developed. When there is torsion or rupture of these ovarian cysts, can lead to nausea or vomiting sensation along with fever. Next is the most important problem caused by this ovarian cyst is infertility. Due to this development of the cyst and also hormonal imbalance, there is no proper production of the eggs. This condition can lead to infertility. Pain in the lower abdomen, irregular menstruation, heaviness in the lower abdomen, dyspareunia, and also abdominal distension. All these conditions can due to ovarian cyst. Remember, don't neglect these type of symptoms. This may look simple, but it can cause severe complications. Now coming to the causes of ovarian cyst. There are multiple causes for this ovarian cyst. Among these, one is hormonal imbalance. These hormonal imbalance can cause development of the multiple cysts in the ovaries. Next is follicular abnormalities. It means follicles fail to rupture the ovaries. Usually follicles are the cells that can release the egg. When there is abnormalities in the follicle, it can lead to accumulation of water and also fluid. This condition can lead to ovarian cyst formation. Along with endometriosis. In this endometriosis condition can also lead to ovarian cyst formation. Next is polycystic ovarian syndrome. In PCOS condition also, due to hormonal imbalance, several follicles may be developed in the ovaries, that we call it as multiple cysts in the ovaries. This cyst formation can also cause ovarian cyst condition. And also some pelvic infections. When there is transmission of these pelvic infections from other pelvic organs to ovaries, they can develop the ovarian cyst condition. So, treatment is essential in these pelvic infections. Next is pregnancy condition. In pregnancy condition, due to hormonal changes in the ovaries, it can also produce some type of cyst that we call as ovarian cyst. But in some conditions, these cysts may persist throughout the pregnancy period without any pain. But in some patients, it may cause pain, torsion, or other complications. Next is, apart from these, some risk factors like hormonal imbalance, obesity condition. In obesity condition also, due to hormonal imbalance, ovarian cyst development may be happen along with use of some fertility medications. These fertility medications also causes hormonal imbalance. Thus, this leads to ovarian cyst formation. So, obesity, certain medications, hormonal imbalance, genetic problems, nutritional deficiency, and also some improper lifestyle practices, all these conditions can cause the ovarian cyst formation. So this is all about the causes and risk factors for this ovarian cyst condition. If you are struggling with these ovarian cysts, Fidicus Homeopathy is the best option. What do you get from Fidicus Homeopathy means? The success of case mainly depends upon the three main steps. One is the treating doctor, second one is the drug device we are following, third one is the infrastructure we have. At Fidicus Homeopathy, doctors are with passion, qualification, knowledge, experience, competence and compassion. The drug device we are following is of top quality medicines, and we are also best in segment. We are getting our medicines from best pharmaceutical companies, and we are also best in segment. The infrastructure we are using is of latest technology and also artificial intelligence. By using this latest technology and artificial intelligence and treatment option, we can give better results to the patient. Now coming to the consultation part of Fidicus Homeopathy. Fidicus Homeopathy provides two types of consultation. One is online consultation. Second one is in-person consultation. In online consultation, audio and video call options are available. By using these options, you can share your reports to us. If any reports are necessary, we will let you know. You can get it back locally and send it back to us. After completing the case check, the main treatment will be started. Once the treatment is started, we will ship your medicines to your doorstep wherever you are in the world. If you are staying in India, it will take 3 to 4 business working days. If you are staying other than India, it will take 3 to 8 business working days. If you want to consult Fidicus Homeopathy by in person, you can visit our nearest branch and get consultation. Now coming to how to consult Fidicus Homeopathy. This is our WhatsApp number 7997101303. By using this number, you can call or message to us and get consultation. If you have any doubts about Fidicus Homeopathy, this is our website www.fidicus.com. You can visit our website. By using this website also, you can get consultation. Why Fidicus Homeopathy only? There are so many hospitals are there. There are so many homeopathic hospitals are there. Why Fidicus only means Fidicus Homeopathy stands for highest chance of health. And also Fidicus Homeopathy mainly follows three main principles. One is the highest success rate, second one is the transparent treatment, third one is the personal care. Regarding this ovarian cyst condition, we are having highest success rate and we are also providing transparent treatment. Transparent treatment in the sense we can explain the condition to the patient clearly, and we are also providing personal care. Mainly homeopathy system depends upon the individualized treatment, so that we are also providing individualized treatment to every patient, and we also advise them to maintain a healthy and balanced life. All these are the advantages of selecting Fidicus Homeopathy. Now we discussed about the what is ovarian cyst, its causes, symptoms, and the risk factors. Usually most of the women can suffer from these ovarian cyst, but here the problem is the rupture or torsion of these ovarian cyst can cause severe damage. If you are struggling with early evaluation and proper diagnosis, this condition can be manageable. If you are struggling with these ovarian cysts, consult Fidicus Homeopathy for a safe, effective, and timely treatment. Thanks for watching.